So good morning, everyone. So this session is more about case analysis. I'm audible, na?
Yes, sir.
Achha. So this session is more about case analysis. And rubric understanding and criteria when to take that rubric. And if time permit, we will be talking about remedy also. So, and this is more of an interaction session. So I would like after case presentation, everyone we will give you 10 minutes or 15 minutes and you have to analyze and interact with me. Okay, all right, we will start with the case now. It's one of the easy case. Huh? And I have learned from this case. So we'll start with the case. Huh? Very interesting learning from this case.
Good morning. Greetings from Medigene Academy. We welcome you to attend this Sunday's interactive Materia Medica session. We will begin the session by discussing a case. I am here to narrate the case. This is the case of a 14-year-old girl with abdominal pain for the last few years. Her abdominal sonography was normal, but the pain persisted on and off. Mother said she fights a lot with her brother and hits him. She fears sleeping alone. She fears the dark and ghost. She gets fearful dreams from which she wakes. She dreams someone is dead and she's crying a lot. She also had some problems at her school. Patient said, a boy used to harass me, throw my lunchbox, and tease me in front of everyone. I would cry since he was older than me and no one would help me. I was alone. I was afraid of complaining to the teacher as I was alone. No one listened to me. He used to do the same to the other students. We discussed with our parents. We went together to the principal and then the boy was scolded and removed from school. This was due to our unity. Initially, I was alone, so I could not do anything. Then we all came together so we could get him punished. Her fears were as follows. Insect can get inside my body and eat my brain. I feel I will die and then I will be away from my parents and family. I can't stand the sight of blood. My Nana passed away some time back. If everyone in the family would die, then who will take care of me? I'm afraid I will have to work at different places. They will not give me enough food to eat. Then I will starve to death. I fear being away from my family and friends. She loves writing stories. A boy's mother fell sick and died. Her stepmother was not good. She used to beat him, didn't allow him to go to school, and did not give him anything. I was affected by visit to an old age home, seeing the old people who are unable to walk on their own and who need care. They provided food, education, everything to their children, and now their children do this to them. So I like the extended family to stay together rather than having a nuclear family. We take care of each other. My mother is very, very religious and always in her work. I feel left alone. My brother beats me. I don't beat him because he is small. I feel angry when he does this. I scold or beat him sometimes. I feel I should not hit him as I'm older than him. Because of abdominal pain, I cannot concentrate on my studies. I feel low because of my pain. I used to be good in studies. Now I'm going down in it. What is happening to me? I don't know. I feel low. I feel sad. When this pain, I feel low. I feel sad. When will this pain get over? I will die because of this pain. When I have milk, I get the problem. Thank you.
So we'll start the discussion within 10 minutes. So in 10 minutes, you tell me what rubric, how you will analyze this case. And then we will start with discussion about the rubric selection, rubric understanding, and the remedy. Okay? So I think everyone has, it was clear to everyone. Case सही से सुना सब लोगों ने? Very easy case, huh? So this is in practice. We have not put a case on slide because when you are dealing with patient, you have to hear and analyze it, right? So this is the way of practice for all of you. So attention span bhi zaruri hai, na? Okay. So it's a practical session for all of you. Purely practical session.
She loves writing stories. So is this?
Right. Subhashini said it is imaginary fears. If someone want to ask or say something, you can unmute and ask. Huh? Horrible things affects her profoundly. Dreams fearful. Yes. Yes, Kirti Pandey.
सब वो जैसे उसको लड़का वो परेशान करता था तो वो कुछ बोलती नहीं थी
तो एक काइंड ऑफ एक उसमें टिमिडिटी तो है और कावर्डनेस, मतलब वो उसमें हिम्मत नहीं है फेस करने की, वो एक चीज है। और फियर, मतलब जैसे इमेजिनरी फियर्स, मतलब वो थिंक करती है कि अगर मुझे खाना नहीं मिला तो व्हाट विल हैपन, आई विल स्टार्व टू डेथ। वो एस्पेक्ट्स है केस में। She is
Yes.
dependent person.
So Shvetali says she is timid,
Yeah.
right? And Ruchi says she believes in unity.
डिपेंडेंट जैसे भी है, बहुत सारे सर्टिफिकेट पे शीट्स अपडेट के मेरे को कौन देखेगा, तो वो चीज को लेके उनको बहुत ज्यादा है। बहुत सारी जगह पे शी सेड कि आई एम अलोन,
Right.
स्टेटमेंट बहुत यूज किया।
So Amna's opinion is that she is more dependent personality.
एक मतलब क्वेश्चन है, मतलब डाउट है कि शी विजन नेग्लेक्टेड आ सकता है।
Delusion neglected. Take 10. This is your rubric, right? Delusion neglected.
Imaginary fears, heightened easily, timidity or cowardice, independence or fantasizing, multiple things affect sentimental and neglected or forsaken.
Right. So Yugam says forsaken feeling,
Neglected, forsaken,
neglected, sentimental,
multiple things affect,
horrible things, sad stories affect profoundly.
fantasizing, imaginary fears,
Fantasizing, right?
or heightened easily and cowardice.
Right.
Also lactation के टाइम पे उनको प्रॉब्लम when I have kind of
क्या?
नहीं लैक्टेशन नहीं, मतलब मिल्क लेते थे so milk aggregation दे सकते हैं।
Right. You can take it, but जैसे food and drinks हम कब लेते हैं? Craving and aversions are taken mostly in acute, right? Because desires goes on changing, right? So until and unless the desires are addiction or higher in intensity, तभी chronic में उसको as in रोग ठीक लो.
So aggravation नहीं है।
Aggravation you can take it. Desires I am telling you. No? Because homeopathy is science, we have to understand what is disease in this case, right? At physical and at mental level. So what is disease in this case? What is to be cured in this case? Her fear, imaginary fears. Right.
Her imagination is also, there are two stories. They are showing a pattern. Okay, stepmother was not good. Old age people they are unable to walk. They need care. It is showing a
Right.
pattern.
Right. So Divya says ki there is a pattern, and pattern about
Someone, I am not knowing the exact word, but there are two stories. Both the stories are showing that someone is not suffering exactly, but a boy is not allowed to do something. Old age people are not cared.
so this is the sensitivity, right? You rightly Divya has said there is a pattern. You have to understand pattern. Sometimes what happens na, जब आपको ये case ऐसा मिलता है, because we think कि there should be a cause, right? There should be a perfect picture, right? But patient हमेशा वैसा नहीं देगा. So this case was selected because of that only. So usual practice जो हम करते हैं ना, कई बार ऐसे अलग भी मिलते हैं. So this is for all the people who wants to understand and analyze case in more evolved way, right?
Both the situations are bichara wala situation.
Yes. So according to Divya, the situation is more of bichara, right? So I think Dr. Sanket has said, forsaken, sensitive to pain, fearful, desire, care and love. Everything starts when she saw people suffering, old age, right? Pulsatilla and calcarea count. Rightly said, Dr. Sanket, you are right. Anyone else?
Sir, what she wants for herself as a care and affection. Most front person who is so sensitive.
Right. So is it she wants care and affection here?
मैंने कौन देखेगा ये लोग?
She many times says मुझे कौन देखेगा अगर संभल रहे या फिर I'm left alone, my mom works. So she needs that particular affection.
So ये चीज she wants to be cared for. She fears who will take care of her if something happens to her family.
Very good.
4 years.
She wants to be cared.
She fears who will take care of her if something happens to her family.
So very rightly understood by Sabha. Huh? She wants to be cared. Right? She wants to be cared for, and she fears who will take care of her if something happens to her family. So this is somewhere in insecurity, right? It is type of insecurity. So whole case says something about it, right? So everyone says it is fearful, right? So this case, if you can I start analyzing it? तुम लोग को समझाना शुरू करो.
Kirti Pandey says she wants protection.
She wants protection, right? Anticipatory anxiety, Hemangi Mishra, right? Dr. Hemangi has said anticipatory anxiety, right? So now this case is about a nervous disorder. Huh? That is why she also says that it is good to live in joint family, not nuclear, because there will be someone to take care. Sabha, Dr. Sabha has said this. Huh? So I think everyone is rightly analyzing it. But this is what we are thinking about case. So how you will convert this into rubric? Right. बिचारी शोक करके केयर गेन करने की कोशिश है. This is by Dr. Sanket. Right. So if you go through the case carefully, you will understand that she is a person who has problem for being alone, right? See, if you read whole case, you will understand that there is an alone. I was alone. She has mentioned many a time. So rightly understood by you all that it is forsaken. Okay. So what is difference between forsaken and loneliness? अगर हम general term में समझे, what is the difference between forsaken and loneliness? Loneliness is अकेलापन, right? This is just in language, not in repertorial understanding, but I'm making you understand. So lonely से थोड़ा हटके is forsaken feeling. In forsaken feeling, you count on someone to be there. Or to stand by you when you need. And when you see, जब उसकी ज़रूरत है, and when you see he is not there. And what you feel at that time, this is the time where you feel forsaken, right?
Sir, ये kind of dependent personality
नहीं, forsaken feeling जरूरी नहीं कि सिर्फ dependent में रहे. So it is a form of emotional affection. So the person who goes into depression can feel this frequently feel this this feeling they will have. Huh? नहीं, ये कंटिन्यूस प्रोसेस होना चाहिए. फोर्सिकन फीलिंग अगर एक बार में आके चला जाता है, so that is normal. But person goes on in this phase for a long time, then the rubric forsaken should be taken. Dependency है, but dependency में क्या, right? So dependency मतलब सिर्फ एक ही criteria है dependency for forsaken. There are many criteria for forsaken feeling. Sadness can also lead to forsaken feeling. Timidity also can lead to forsaken feeling. Dependency also can lead to forsaken feeling, right? So it is not only dependent. There are other remedies who are not dependent, but then also they feel forsaken feeling.
सर जिनमें वो affection और want of affection रहेगा वो भी रह सकते हैं.
Yes. Because they are very attached to the people, right? The people who are very affectionate, they are also attached with the people, and they expect something from them. And when they feel कि अरे वो नहीं है, they have not fulfilled the expectation, that can also arouse forsaken feeling in them. So there are many criteria. So before taking forsaken feeling, you have to understand why she feels this, right? What is the reason for feeling this? So commonly forsaken feeling arise because of depression, sadness, depression, expectations. So as I said, you count on someone to be there, to stand by beside you, but when you see and he is nowhere, this is what forsaken feeling is, right? So it has a difference between company desire, right? What do you mean by company desire? Want company, right? और उसको जरूर कंपनी चाहिए, right? ठीक है. So ये और ये दोनों अलग है, right? ठीक है.
Abandoned कैसे अलग?
Abandoned is again a form of forsaken feeling. वो बहुत different है बेटा. Neglected is different. See, forsaken feeling is the broader aspect of and delusion. Neglected is a false perception of that she is being ignored. So ignored in the form of, that is the person who is very sensitive. समझो मैं expect कर रहा हूँ, जैसे पल्सिटिला, she expect कि you should take care of her, right? And अगर एक भी gesture ऐसा होता है ना कि if you are not taking care, she will get offended, right? Same for nature also. So there is an oversensitiveness and a bit ego also. Delusion neglected. Okay? So delusion neglected or finer है about forsaken feeling, but these are the things which will happen in delusion neglected. Again, it is a false perception. Delusion should be taken when there is a delusion, right? Delusion is an abnormal aspect of behavior, right? It is an abnormal behavior aspect, right? So in homeopathy, we take delusion as जब हमको मर्जी है तब ले रहे. नहीं, this is wrong. Huh? This is absolutely wrong. You have to understand when to take delusion, when to take things कि क्या लेना चाहिए. अभी ये केस में what is very important here? So there is one thing कि she feels whenever she needs someone, right? That's why she says कि जैसे वो boy harass कर रहा था तो I was alone, I can't do anything, right? जैसे when came about कि her nana passed away, she feels that कि अगर सब चले जाएंगे तो क्या होगा, right? So there is a feeling that people will go away, right? जैसे my close person will go away, so how can I survive, right? second thing which she had mentioned again and again is about death. Right? So is it fear of death? No. See, whenever you are taking case, sometimes case is direct. Patient says there is fear of death, but sometimes they go on talking about death. This case, a 14-year child has an issue, emotional issue. She has not landed up into delusions. Huh? This is emotional. She has more of fear, right? Fear of being alone, right? कि मैं अकेली हो जाऊंगी तो क्या, ऐसा कुछ हुआ तो क्या होगा, ठीक है? This is just an explanation of her. This is not false perception of her, right? And second, she's mentioning about death again and again, right? So there is two rubrics which you can consider here. That is fear death and death presentment of. So in this case, that fear death will not be a appropriate rubric here. Right? Why? What would be the rubric here? That is death presentment of. What do you mean by death presentment of? That is, patient cannot stop thinking, talking about the death. So in this rubric, there can be fear or there cannot be fear also. ये दोनों भी हो सकता है, right? But in fear death, definitely there is in fear. It is in phobia. ठीक है? That rubric is about phobia. Fear that is phobia. And death presentment is more of thought, talk, mind में वो चलता रह रहा है. It can arouse anxiety, it cannot arouse anxiety. So there is no defined नहीं है कि whether it is anxiety or no, right? It is just a thought, talk, or she is engrossed in that pattern, right? अगर तुम लोग देखो तो she mentioned frequently about her कि something will go and brain में कुछ होगा and I will die, right? But there is fear? No. Right? Means she has not mentioned कि I am fearful. She mentioned two things: death, about grandparents, जो उनके नाना गए. Secondly, अगर सब चले गए तो मेरा क्या हो? Again, right? So there is an forsaken feeling and death subject which is going on. So there are two rubrics you can take here: is forsaken feeling and death presentment of. So I have differentiate forsaken feeling from company aversion to a company desire and loneliness, right? Loneliness is simple understanding. It is not a rubric understanding, right? But तुम्हें उसकी अहमियत बताने की कोशिश करो कि when forsaken feeling should be taken, right? So कोई बोले कि मैं अकेला फील कर रहा हूँ, that is also forsaken feeling. कोई बोलता है ना कि कोई नहीं है मेरे साथ अभी, नहीं? So that is also forsaken feeling. And here also, what she feels कि ऐसा कुछ होगा तो. So there is an anxiety of being alone, right? Right? So it is not fear alone. Again, fear alone is phobia. Whenever fear topic कोई एक topic का आया ना, तो that is phobia, right? Clear हुआ? So now I will explain how you should understand fear pattern. So this is the second understanding, that is fear. So fear rubrics कैसे लिख सकते हैं? जैसे fear क्या है?
So please explain when do we take anxiety about death about how did the patient express?
Yes, Juhi. मैं अभी वही mention करने वाला हूँ. So I will explain you when you should take fear death, right? So fear, it is not only fear death. We'll talk about all fears, the phobia, the rubric phobia, right? Like fear death, fear alone, fear dog, fear snake, fear animal. These are the phobic rubric. So how homeopathy is very scientific. उसको इस तरह नहीं लेना है, हेवाया, right? So what is the criteria for taking this type of rubrics? I think everyone knows, na? Fear death, fear alone, fear dog. These are simple rubrics. Fear insects, right? Fear bird, fear rain, right? These are phobic rubrics. These are not general rubrics. You cannot take it when there is an anxiety for something, right? Although this phobia is arising from anxiety disorder, right? People who are anxious, they can go to a phobic conditions, right? So what is the criteria to understand this? As Juhi's question is, that is, there should be a marked fear and anxiety, there should be a marked fear and anxiety about specific situation or specific objects, right? But there should be in specificity. When should we take this fear animal, fear death? So kab lenge? When there is a mark higher in intensity and specific. It should be very specific. Generalized nahi hona chahiye, right? So first criteria to take any fear, this type of fear ka rubric hai na, usko kab lena hai? When there is a mark, yes, intense and specific. Okay. Second, for example, if certain situation provokes immediate anxiety or fear. So for example, if person sees dog and he is so anxious कि वो दूर से कुत्ते को देखकर है ना किसी के पीछे भागना या वो रास्ते से छोड़कर दूसरी जगह पे चले जाना, right? So what is this? Again, this is a higher intensity. It is provoking fear and anxiety, right? Again, it is very specific. The second criteria is that it should provoke always, always. ऐसा नहीं कि किसी को कुत्ता काट लिया 2 दिन पहले और 2 दिन बाद किसी को डर लग रहा है कि अरे कुत्ता काट लिया. That is not phobia. That is just an anxiety. But if it lasts for a long time, then it converts into fear, fixed fear. Clear ho raha hai? So third criteria for taking this rubric is the long duration of fear remaining. It should not be variable. मतलब आज डॉग का डर लग रहा है तो कल बर्ड का डर लग रहा है, नहीं. Phobia is very fixed. Then only you can take this type of rubrics, right? Fear of death
or anxiety are two different things.
नहीं बेटा, rubrics में anxiety death है क्या? देखो so I have explained 3 criteria for it. One is mark, higher intensity and specificity, specific about object and situation. Secondly, almost always provoke anxiety to certain subject or the object. Second. And third, it should be a long period. It should not be short. So there is anxiety that
Cross-reference fear.
yes. Okay. So see, everyone has fear of death. Nani, right? But जब वो anxiety है, it is variable, it goes away, then you shouldn't take it, right? The patient coming with किसी को कैंसर हो गया और पेशेंट आके बोल रहा है कि नहीं अरे उसको कैंसर हो गया, मुझे डर लग रहा है कि मैं मर ना जाऊं, और कल आके बोलेगा कि नहीं ठीक है सर, ठीक हो गया, कोई प्रॉब्लम नहीं, अभी मुझे ऐसे लगता है कि मेरे को कोई बीमारी ना हो जाए. सो दिस इज नॉट फियर दैट, दिस इज एंजाइटी हेल्थ, राइट? So unless and until it is the three criteria I've said, fourth criteria is when it is out of proportion to the actual danger posed by the specific object. इसका मतलब क्या है? The fear is out of proportion to actual things. For example, एक केस मेरे पास थी, उसका था कि वो जब भी लिजर्ड देखती थी ना तो इतने जोर से चीखने लगती थी ना कि उसके आजू बाजू के लोग सब जमा हो जाते थे और उसके साथ मिलकर है ना वो लिजर्ड को भगाने की कोशिश करते थे, राइट? सो दिस इज एन आउट ऑफ प्रोपोर्शन फियर, राइट? सो फोर्थ क्राइटेरिया इज आउट ऑफ प्रोपोर्शन फियर. मतलब जिस तरह से रिएक्ट करना चाहिए उससे ज्यादा रिएक्शन हो. यस, आउट ऑफ प्रोपोर्शन. एग्जेगरेटेड वुड बी थोड़ा उसका रूब्रिक अलग चला जाएगा, ठीक है? फिफ्थ वुड बी when person starts suffering and avoiding the situation. This fifth criteria is जब तुम उसको अवॉइड करते हो, जैसे फॉर एग्जाम्पल वो एग्जाम्पल दिया ना कि डॉग को देखकर रास्ता बदल देना, दिस इज अवॉइडेंस, राइट? बट इट शुड नॉट बी फॉर वन और टू, इट शुड बी ए लॉन्ग क्राइटेरिया, ठीक है? एंड फोर्थ, sixth, if it is hinders in your daily life, so then only you can take this type of fears. This was the criteria for example for criteria for fear that, fear dog, fear snake, all fear, and these fears are phobic fear, right?
So first criteria, higher intensity, second out of proportion.
बेटा वो मैं स्पेसिफिसिटी की बात कर रहा था ना, तो ये जो प्रोवोक की बात है ना, वो आउट ऑफ प्रोपोर्शन मतलब है ना एक और क्राइटेरिया, मतलब और स्पेसिफाई करने के लिए मैंने उसको और मेंशन किया, क्योंकि तुम्हारा ध्यान सिर्फ उस पे ना जाए कि एक्सट्रीम. सो स्पेसिफिसिटी भी है, प्रोवोक्ड भी है, आउट ऑफ प्रोपोर्शन भी है. दिस वुड बी द क्राइटेरिया. लॉन्ग ड्यूरेशन, continue for one subject going for long duration, that fear goes for long duration, that is also criteria. ठीक है? So like for example एक रूब्रिक है ना, देखो fear stranger निकालो तुम्हारे रिपर्टरी में.
Fear strangers.
हाँ, so देखो उसमें कौन सी रेमेडीज हैं?
Amdacesia, Baraita, Bufo, Carbovec, Carcinosin, Causticum, Cupramet, Dysentrico, Califos, Lachesis, Lyco, Plumbum, Pulsatilla,
Yes.
Silesia.
Now you understand this rubric also. Again, this is the same, na? It is the phobia, right? Now, how Lyco, because everyone knows Lyco, that's why I'm giving one example. Strangers ka how he face, he will not go in front of strangers. So what happens to him? There has been anxiety, right? Anxiety to face people, and when he's forced, he will face, right? But वही डिग्री डिफर कैसे होती बराइटा काब में? although they are being forced, they will not go. Right? Just a child coming in your clinic, hiding behind mother, and उसको force भी करोगे ना तो वो नहीं आएगा बाहर. Right? So this is how this fear phobia can arise, right? So this is again a fear phobia for strangers, right? Okay. So and that's why anxiety facing people, public, LICO has, right? And why this happens? This is the different criteria for LICO, right? Lycopodium can overcome, and there would be only anxiety. But some LICO, when they go into failure aspect, that fear उनके अंदर बैठ जाता है. So there is fear of failure. I have seen lycopodium not starting new things. This is again what? This is in phobia, fear. They will avoid, they will not start new things, they will not meet new people. And in that depressive aspect, means ये anxiety से fear में enter कर रहे हैं, depression में enter कर रहे हैं, they will avoid everyone at that time. They will not do any new thing, and they will go on deteriorating in their life. So it is interfering in their daily routine life. मैंने जो criteria बोला, clear हुआ तुम लोगों को? So rubric selections and understanding is not hypothetical explained. These are provings, and these are disease. These are not normal aspect, right? So homeopathy is more very scientific. If you understand it in this way, you will understand everything clearly. And this is what we have to learn. We have to change in our homeopathy, right? Doctrine of signature बोल दो और समझा दो कि ये ऐसे होने वाला है. This is not right criteria. By proving was not done by doctrine of signature. Right? Proving was done by giving, and this anxiety, this fear, this phobic understanding was aroused in them, and then it was noted. Okay, clear हो रहा है? Yes.
So, mind stranger presence of aggravate. ऐसा मतलब एक
Mind.
Stranger presence of aggravation.
Yes.
मतलब stranger.
So mind. This is again they get aggravate. What aggravates? That is anxiety aggravates. They become very anxious. They become awkward. ठीक है? Clear हुआ तुम लोगों को? So these are the criteria when you should take this. Second, now we'll talk of fear of death. जैसे मैंने तुम लोग को बताया ना कि death presentment is what? It is patient cannot stop thinking about that, talking, thinking, right? So when this goes into thought process, that means what? It is an obsession. Right?
So very question, Dr. Subhash. Sir, when a patient is extremely fearful about health and disease and becomes obsessed, compulsive, then what do we take?
Right. So, so you can take here as an anxiety, health, and secondly, conscientious about trifles. Again, conscientious of trifles is an obsession. It is the rubric of obsession. Okay, Subhashini? So this qualifies something. So we were talking about that presentment, right? So that presentment is patient cannot stop thinking, right? And he will go on talking about it frequently. In case you will find, जैसे ये case में you have seen, she was ऐसे ना वैसे she was going on. The word was coming up with fear, right? Okay. So how we can take fear of death, right? Okay. So fear of death can be taken when there is an extreme and overwhelming fear of death. or dying process. मैं इसका एग्जाम्पल देता हूँ तुम लोग को. Or fear of own death, or the fear of death of other people, right? So one case, she came to our clinic, and when she was narrating, she narrated that कि जैसे ही मैं ना वो white चादर देखती हूँ ना सर, तो मुझे ना डर लगता है, मैं उसको देख ही नहीं सकती, right? So this is dying process. She is not telling us directly कि she has fear of death. Clear हो रहा है? It was just कि she said कि that white चादर also, the बोलते हैं ना ये लकड़ा जो यूज करते हैं, मटकी जो यूज करते हैं, सिर्फ वो भी देख लें ना तो she gets fear, she avoids going there. So patient will not say कि fear that. This is again the process, नहीं? This is a process. So at that time also you can take fear that. Sometimes people say, for example, कि मुझे डर लगता है कि मेरे मम्मी पापा मर जाएंगे तो क्या होगा, right? क्या वो कभी कभी बोलते हैं, we take affectionate and then we go for fear, right? But this is again a phobia, fear that, right? For their loved one. So again there is a rubric that anxiety for their parents or relative, right? About loved one. That अगर तुम rubric निकालो, देखो, fear loved one का एक rubric है. Fear death of loved one. So हम क्या डिस्कस कर रहे थे? हाँ, so वो rubric निकाला तुम लोगों ने? Everyone has repertory with them. See, this is very important to understand. Before understanding remedy, you have to understand all these things. When we should take, what is to be cured in disease, as Dr. Hahnemann has said. So वो share करो ना. मिला तुम लोग को fear? हाँ, so fear देखो ना, losing loved one, ना नीचे एक rubric है, fear losing loved one.
एक rubric sentences में है, fear help loved persons about health of.
Yes, huh? So these are the different rubrics, right? So जैसे I have encountered this thing, this form, right? जैसे I said ना कि fear that can be taken when there is extreme overwhelming fear of death or dying process. Huh? Second is dying process, and third is fear of own death or other death of other people, that is loved one. Huh? So then also you can take fear death. Okay. So we learned about forsaken feeling. We learned about fear death, how you should take, and how fear death is differentiated with death presentment. Right? Okay. Now, if in last paragraph you will see what happens because of this pain to her, because she is very sad. She becomes low, sad, not able to concentrate in her studies, right? So what this rubric indicate? ये rubric क्या होगा? It is that she is sad, right? Sad because of pain or because of her suffering, right? So what rubric it could be? Yes, beside being self वो है, but यहाँ अगर देखोगे तो she is sad, right? So this is in specific. She said, I am low and sad. So sad, sadness from pain or sadness about disease, right? This would be the two differentiating rubric here. So again, you will see when she says, when this pain will go over away, and I will die because of this pain. So what is this? This is not anxiety. This is sadness. In sadness, she is expressing कि ये दर्द की वजह से मैं मर जाऊंगी, right? 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 This is not कि अरे मैं मर जाऊंगी, मुझे क्या होगा? This is she is in sadness because of this pain, right? That's why sadness with pain or sadness about disease. These are the two rubrics which will come very closer. So we have taken here three rubrics here, right? One is the forsaken feeling, general one. Okay, general one. Because पहले हम general समझेंगे, then we will go for specific rubric. Second is that presentment of. Okay, forsaken feeling, that presentment of. So, Shubham, you are repetizing it now?
Yes.
कौन सा लिया तूने?
Sadness about
And sadness about disease. Huh? This is about. So we'll repetize it. And the remedy are coming like alumina, like difluoricum and sulfur, right?
In synthesis, it is phosphorus, sulfur, and lactifluoride.
Yes. So कौन सा है उसमें?
Phosphorus,
sulfur,
alumina,
and lactifluoricum, right? So in this case, the remedy given was lactifluoricum. So again, we will be having the session of all the LACs. How to understand and how to prescribe LAC canine, LAC difluoritum, LAC humanum. एक humanum case तुम लोग को दिखाया था मैंने, right? Last time with rubric understanding. So this is the case presentation, and then we will talk about the remedy. Okay. So this is the remedy which we have prescribed. There are other remedies which have fear, right? Fear of death. So remedies like aconite. मैं few remedies तुम लोग को explain करने के लिए बोल रहा हूँ. So like aconite, Simisifuga, right? Elapse, right? अगर तुम लोग देखोगे ना तो लेक डिफ्लोरेटम का एक रूब्रिक निकालो अबाउट लेक डिफ्लोरेटम को रिपोर्टरी पे लाओ. इस पे रिपोर्टरी शिप पे इस पे लाओ बेटा. हाँ रिवर्स रिपोर्टरी. Yes. So I will explain like defloretum in detail later on. The next month the session would be of LAC remedy. तो सारे LAC remedies हम explain करेंगे. So in reverse repertory you will see क्या हो रहा है? बंद पड़ रहा है. So Sanket says कि why not pulsatilla? Dr. Sanket, pulsatilla, इसमें if you see ना, there is more of a sadness, and sadness about what? About my people will go away, right? This is what it is tormenting him. It is affecting him, right? So ये जो combination है ना, sadness और people चले जाएंगे, ये ना leg defloretum का है. Rightly pulsatilla can be prescribed, right? अगर तुम लोग देखोगे तो leg के पहले you will think of pulsatilla frequently. ऐसा नहीं कि this is not right, but if you finalize it, then you will find कि leg has that feeling, right? अभी देखो, if you go down, so you'll find that presentment without fear. So they predict the time of death, right? Close करना. Predict the time of death. नीचे जाओ, नीचे जाओ. So that thoughts of और जो देखो cloth wet is, हाँ? ये जो है ना delusion cloth wet is, it is an obsessive feeling of leg defloretum. ठीक है? So अभी देखो delusion about he will die about, right? And there it has no fear. देखो delusion die about to he is, fear has no, right? ठीक है? So this is what the characteristic of leg defloretum is. नीचे जाओ. Again you will find there would be an obsession, right? अपना obsession, oppressed feeling, like suffocation, narrow, that is. See, in कारण इसमें है ना बहुत कम rubrics हैं. अगर तुम और अच्छे evolved repertory में जाओगे, you will find more rubrics which would be related and you can understand it much better, right? So one feeling of जैसे ऊपर जाओ ना जरा. So अभी देखो, delusion convent will have to go to A. What does it mean? What is convent? Convent मतलब एक तरह का nuns लोग जहाँ रहते हैं ना, वो. So they have to leave everything, right? ना? So ये rubrics को समझना बहुत जरूरी है. This is a false perception. She is feeling or he is feeling that she has to, will be, na? Will have to go. This is will have to go. She has to go. She is not there. She feels, right? And why she feels? One rubric और है जो इसमें नहीं mention है. That is delusion. All her friends are dead, and she will go to a कॉन्वेंट, मतलब उसके लोग सब चले जाएंगे और उसको वहां जाना पड़ेगा. So this is what lac defloratum feeling is, and that's why lac defloratum is very sad. It is one of the depressive remedy among all lac. Very depressed and sad. You cannot give lac defloratum to a बोलते हैं ना कि जो खुशी मना रहा हो, नहीं, right? It is one of the depressive remedy, right? A depression of lac defloratum and pulsatilla has different meaning, right? Lac has कि shifting pain रहता है उनमें, lacs में, right? Pulsatilla का pain भी shifting हो, but mind भी shifting रहता है. So mood changeable is more in pulsatilla, right? But lac defloratum is more depressive than pulsatilla, right? Okay, so we will understand other rubric remedies like we'll go to learn about LAC. LAC is again a fearful remedy, right? We will see practical. So these are two remedies which I decided to थोड़ा सा explain you all, so that तुम उसको अपने practice में utilize कर सको इसके लिए. हाँ. So now you will see elapse. Elapse में भी there is an fear alone of being. Ailments from alone. So there are two sensitivities. One is being contradicted, and one is of being alone. So what kind of fear they have? Fear being alone. Fear of being alone. Fear of being alone, company with aversion to, yet fear to be alone. Aversion to company, yet she wants people, right? So if you see in this case, the elapse has feeling that something bad will happen. There is an anticipatory anxiety of having something bad, but not fixed. It's not fixity नहीं है, right? And in that they have fear of being alone. But because of this fear and anticipatory anxiety, they feel that they have become very restless, and they feel that they should run away from this situation. And that's why you will see that they like traveling. ना जैसे एक रूब्रिक है, मतलब एक रूब्रिक है कंट्री करके, चलाओ ना रूब्रिक को. हाँ, और नीचे लाओ. और नीचे एक मिनट, ऊपर चले जाओ, ऊपर जाओ. हाँ, एक मिनट में बताता हूँ. क्विक स्लोली जा. हाँ, एक मिनट. देखो ये country desire for to go into the, what does it mean? नहीं, इसका मतलब क्या है? Only 4 remedies ना, निकालो country का meaning निकालो. So you will see elapse being very sad, because of this anticipatory anxiety of something bad will happen, right? कुछ बुरा होने वाला है, कुछ बुरा होने वाला है, वो डर, right? So they become very anxious about it and they want to run away from this feeling. And this rubric comes. So one way of expressing relapse is running away, traveling. Second, being sad and not talking to anyone. But yet they will warn people because of fear of being alone. So they will be sad, not talking to anyone. एकदम अकेले पड़ जाएंगे. निकला मीनिंग निकाला क्या है मीनिंग?
The land and sea of a countryside.
और मीनिंग निकालो.
Indefinite, usually extended expanse of land. Secondly, land का rubric है. Third, political state, people of a state or district. Rural,
Land outside town and city.
Yes, the land outside town or city. Right. This is going away from it, from the situation what she is feeling. Again, you will see there is fear rain off in elapse. So this is phobia for rain. Huh? अभी कोई कोई डॉक्ट्राइन ऑफ सिग्नेचर बता देता बारिश होती है इसके लिए स्नेक बाहर आ जाते हैं for elapse. नहीं, that is not right explanation. It is when it was proved there was a feeling when there was rain they used to get anxious. Right? This is again one of the phobia. And that's why it can't be explained in this elapse. Okay. So how homeopathy is very scientific. You have to understand all these things. ऐसे ही तुम कुछ explain करके उसको रेमेडी को समझने का गड़बड़ मत कर दो. उसको क्या बोलते हैं? एम्ब्रोफोबिया. Fear of rain. How scientific repertory is, and this has been proved. This repertory is made by all our stalwarts at that time, right? And how we are taking rubrics? ये वाला, right? So rubric understanding, remedy understanding should be done scientifically. It is science. It is not hypothetical or doctrine of signature add कर दो और ये कर दो. We are ruining homeopathy in this case. Huh? So you have to understand all these things. Okay. Now we'll understand Mancinilla. एक rubric remedy निकालो. NANC. So elapse समझा तुम लोग को कैसे डिस्क्राइब करना है? एक छोटा सा जिस्ट सो दैट ये तुम उसको मिस ना करो. सो इसका पहले पूरा नाम बताओ. Mancinilla.
हिपोमेंस.
हाँ, ठीक है. So this is the remedy. और अब ये remedy how it is again a fearful remedy, and there is fear of death. But if you see this, you will find something which is, see, aconite जैसा बहुत extreme fear होता है ना. They also have extreme fear because of pain, right? And what they do, they become very anxious. Aconite become very anxious, anguished, agonic type of anxiety it is. And what they do, जब उनको fever हुआ या anxiety होगा, they will feel that they will die. And in that they will predict, अरे अभी मैं मर जाऊंगा. Prediction is not कि they are saying कि अरे इतने बजे मर जाऊंगा. नहीं. This is that I will die. I will die now. मुझे ये जो suffering हो रहा है ना, This is heightened acute way of expressing anxiety. Again, Mancinella is again a acute way of manifestation, but what? That was anxiety and fear, right? वो acute phobic conditions होता है. Aconite can be prescribed in that way, right? I prescribe aconite as a constitutional also, where that lady used to feel कि जब भी वो 12 बजेगा ना तो मेरे को कुछ हो जाएगा, and she used to hysteria हो जाता था, and she used to start feeling that she will die at 12 o'clock, right? And aconite treated her, right? So this is how you can prescribe when there is a chronic aspect, but in that also there would be a time where she feels this type of fear, otherwise she will be better, right?
It can be that presentiment.
That presentiment or that fear of death. Huh? So death presentiment is broader one, huh? Okay. अभी इसका fear निकालो. I will explain the fear of. So this is good remedy for mental disorders. Huh? अभी किस तरह का mental disorders? You will see that they will be taken by evil or devil. Again, this is what? This is not a simple phobic condition. It goes into the form of delusions. Mancinella is one of the good remedy for the people who go into condition of schizophrenic conditions. So it has a good range from severe, simple anxiety, phobia, and schizophrenic conditions. Right? नहीं, they will be taken away by it. मतलब वो उनको आके harm करेंगे या लेकर चले जाएंगे. This is what they feel. And in that there is a fear of death. So directly fear of death कहाँ तुम्हें? Aconite में मिला. Arsenic also, again fear of death. Right? Okay. So this is how you have to understand. Whenever you are taking rubric, you have to understand remedy properly. Yeah? So next session would be more of all the remedies, and I will be explaining all the remedy in this way. So any other question you have?
Sir, I have a doubt. वो जो केस में insecurity अभी भी मुझे थोड़ी सी
Naturally, it is insecurity ना कि अगर मेरे family members चले गए, मर गए ना, तो मेरा क्या होगा ना? So there is a forsaken aspect कि they will not be around, and plus phobia, fear क्या होगा, right? And in that she is depressed, she is sad. Okay, so what is to be cured? That was not abdominal pain because there was no pathology in it. It was mental issue which has gone to the extent of describing the pain. Pain को वो किस तरह express कर रही थी? That she will die with the pain, and
Thank you everyone for attending this session. Next month, we will have a discussion on all the LAC remedies. If anyone has any doubts, one can mail us or ask the doubts in the next session. Thank you.